Good morning, ladies and gentlemen. I'd like to express my sincere appreciation to Professor Varachar Machai and Professor Ratakon Vlachon for their kind invitation to this very important ASEAN meeting. Actually, this is the third time I'm participating in this meeting, but the very first time I'm actually here physically because for various reasons, I could only take part in the Zoom meeting. So I'm very happy to be here this morning. I'll be talking about precision of endoscopic diagnosis and practice in the era of environmental sustainability. So this is outline my talk. Firstly, I'll talk about healthcare and how it impacts upon climate change. And then I'll talk on recent advances in endoscopic imaging, in particular image-enhanced endoscopy and artificial intelligence. And then we'll try to discuss how advances in endoscopic imaging can actually help promote environmental sustainability. I think we are all quite aware that we face an existential threat due to the effects of climate change. There has been a relentless rise in global temperature over the last decades, ever since the Industrial Revolution, due to the impact of greenhouse emissions from human activities. And therefore, whether or not we can do something to mitigate it is something that we need to address urgently. In fact, I think in order to prevent the further increase in temperature beyond 1.5 degrees Celsius, we actually have to embark upon the strategy of net carbon emission by year 2050. So, what are the actual impact of climate change on human health? I think there are two aspects. One will be the direct effect due to extreme heat, weather, and so on. And then there's the indirect impact because of the effect of climate change on ecosystem, on how disease transmission can be affected, its impact on global economy, and also population displacement. As a healthcare sector, we need to grapple with all the challenges from climate change to manage the diseases brought about by climate change. But on the other hand, we also contribute to greenhouse gas emission and therefore also contribute to climate change. In a recent study, it's been shown that during the period from 2018 to 19, the healthcare sector actually contributes about 5.2% of the total greenhouse gas emissions. Although we may say this is not so big compared to the energy sector, which is responsible for about 75% of the greenhouse gas emission, even then, because of the urgency of the situation, I think all of us must play our part to make the earth better. So, related to our own practice in particular, such as GI endoscopy, I think a previous study has shown that among all the services within the hospital, GI endoscopy actually ranked as the third largest contributor to greenhouse gas emission after anesthesia and intensive care. And in terms of the actual breakdown of what we do that lead to greenhouse gas emission, I think this study showed that the two important components are actually travel by patient and staff, but importantly also the equipment that we use. In particular, the majority are due to the equipment directly related to endoscopy. So therefore, we must be mindful because when we do endoscopy that is not so appropriate, it actually has a cost in terms of carbon cost of inappropriate endoscopy. And therefore, this is something that we need to be mindful of and take note to somewhat reduce. I now switch on to the second part of my talk, which is about advances in endoscopic imaging. I'd like to focus on IEE and AI. We all hope to improve our endoscopic detection and diagnosis. And I think the foundation is actually quality endoscopy, high quality endoscopy. It means being meticulous in how we do the scope. It means performing a thorough, complete examination, and also doing it in a timely manner, not being too rushed, but carefully examine all areas. And certainly, every year or every few years, when the different companies launch a new system, we do get better clarity. The imaging resolution does improve. either from the scope system or even from the TV monitor, because then we can see better. But apart from all this, image enhanced endoscopy can help us maybe see better, detect the more subtle mucosal lesions that we might otherwise miss from white light endoscopy. And in recent years, we have increased interest, and in fact, it is now commercially available for us to use AI during endoscopy, especially for lower GI endoscopy, in terms of increasing detection rate, helping to corroborate our endoscopic diagnosis. And in some of these systems that may be available in some regions but not others, it can also help to improve our quality of endoscopy. So I would like to, in terms of IEE, I'd like to focus on two newer technology, which is link color imaging from Fujifilm and also TXI from Olympus. These are the two newer IEE technologies that help enhance the focal mucosal lesions so that these pathologies stand out against a broader background of a whiter background. And therefore, it can potentially help us to see better and detect better. Obviously, the exact technology between these two are somewhat different, but the ultimate aim is to enhance that pathology so that we can see it and then examine it more closely to make a diagnosis. I'd like to offer real-life examples of these two technologies that I use in my daily practice. So firstly, you can see that when you look at LCI compared to white light imaging, LCI can clearly accentuate the sessile or flat lesion much more than white light imaging. Also, TXI, which is actually more recently introduced, can also help us to visualize a flat lesion more clearly compared to white light imaging. So, but all these are just purely theoretical considerations, because sometimes theory may actually not translate into actual clinical evidence, clinical practice. So it's important to see what are the actual outcome data that's out there. So this is a randomized controlled study, multi-center Asian Pacific study that I was fortunate to be part of, and it was led by Professor Suzuki and Gotoda. So this study actually randomized patients into two cohorts. One would be withdrawal using white light imaging, and the other is withdrawal using link color imaging. And you can clearly appreciate that link color imaging can increase the adenoma detection rate, and also it can help us see the sessile serrated lesions better and therefore increase the detection rate of sessile serrated lesions. In the case of TXI, it is even newer. So I think at the moment we don't have published RCT yet, but nonetheless, retrospective data will suggest that it can also help improve visibility. So these are two recently published retrospective studies that showed that regardless of the shape of the colonic lesion, TXI can help improve the visibility, as you can see from the visibility score, be it a regular polypoidal lesion, a sessile lesion, or a flat lesion. And it is also helpful in the case of SSL. This is a multi-center observational study. Again, it's really retrospective, not prospective. And again, it highlights the fact that TXI can help us pick up more lesions, pick up more adenoma, increase the adenoma detection rate. We are all very familiar with narrowband imaging, or NBI. And this has been available for, I think, more than 20 years already. And certainly it has been shown to help us improve our endoscopic characterization and therefore diagnosis from esophagus until the colon in terms of esophageal squamous cell neoplasia, Barrett's dysplasia, gastric cancer, colonic neoplasia. And I'd just like to highlight that although it started off as NBI, but any kind of narrow bandwidth imaging from whichever technology, be it blue laser imaging from Fujifilm or OE from Pentax, I think it can serve the same function, because the aim is actually to just enhance the vasculature at the mucosal surface. And just to highlight that with the newer endoscopy system, be it the EVIS X1 from Olympus or the Fujifilm system, they all have a brighter illumination and therefore more contrast. And therefore, I think all this is very helpful to help us make a better endoscopic diagnosis, because then the image becomes more vivid, sharper, and maybe you can be more confident when we make the call in terms of whether it's dysplastic or not, and also the stage of the dysplasia. Let me just take a step back and move on to the other component, which is artificial intelligence. I think it is commercially available in many countries right now. And at the moment, most of these systems are for colonoscopy. I think we all know very clearly now from both randomized controlled studies across the different continents and also meta-analysis of all these RCT that certainly computer-aided detection can help us increase the detection rate in terms of adenoma detection rate and also adenoma per colonoscopy. And this is of importance because we do not want to miss a lesion which may otherwise progress and then become more advanced, and we have to use more resources to treat in the years to come. And AI for detection is not just for the novice, because this study shows clearly that although it can help improve the level of performance of novice, even the experts will benefit. Even the experts can be helped to improve their detection rate. Most of the system currently focuses on colonoscopy, but in some countries in Asia like China, such AI system is also commercially available for the upper GI tract. So this is a study from China that showed that, and it's an RCT that showed that we can use AI to improve detection rate and decrease the miss rate for early gastric cancer and neoplasia. Now let's move on to diagnosis, how AI can help us make a better diagnosis. This was a multi-center Singapore study that my colleague James Lee was the first author. And the key conclusion of this study is that when there's concordance between the endoscopies and the AI system, we can actually increase the diagnostic accuracy at both the polyp level and also per patient level. So this can help us make a better diagnosis and help us to plan therapeutics better for our patients. In terms of upper GI, again, there are systems that are available that can help us predict the presence of gastric cancer and also its depth of invasion, and therefore help us guide our treatment strategy. This admittedly may not be available in all regions, but it is commercially available in some parts like China. For the lower GI tract, although most of the current widely available technology just focuses on detection and also a dichotomous differentiation between whether it's neoplastic or hyperplastic, there are systems in evaluation that look at prediction of the depth of colorectal cancer invasion, and this will be relevant in terms of guiding us to make a decision whether we should attempt endoscopic resection or send the patient directly for surgery. Now, how about quality? Because I highlighted earlier that a quality endoscopy is the foundation for us to make better diagnosis. So there are AI systems that can facilitate quality endoscopy in terms of doing OGD to highlight the amount of blind spots that have been not examined, and also in terms of doing colonoscopy, help us check on our colonoscopy scope withdrawal time, and also feedback to us whether or not there's adequate bowel preparation. So all this will go a long way in ensuring that the endoscopies practice quality endoscopy. Now, how do we actually integrate advances in imaging and environmental sustainability? Because sometimes we may think, oh, actually let's stop, because the greenhouse gas emissions were from scientific progress, from industrial revolution and so on. So maybe we should take a step back, don't progress so fast, and therefore we not heat up the earth so much. And maybe would that be a intrinsic contradiction between adopting technology and being environmentally sustainable? But actually, in reality, not, because we can actually harness technology to improve our practice and also reduce waste. Because essentially, by using technology, maybe we can see better, we can spur the drive to reduce waste and also improve our procedural efficiency in terms of the diagnosis, in terms of the follow-up, and so on. So in the context of using image-enhanced endoscopy and artificial intelligence, I think there's a lot of promise because by using such technology, we can firstly help to reduce our miss rate and therefore help to pick up things that may otherwise progress and require more resources to manage in the downstream. At the same time, we can appropriately diagnose and stage pathology and therefore guide appropriate treatment in terms of assessing the feasibility of endoscopic resection versus outright referral to the surgeon, in terms of minimizing the use of futile procedure, and also avoiding under or over treatment. And I think it can serve as a guide for us to give appropriate surveillance intervals. And also by being more precise in our diagnosis, care delivery, we can reduce waste. So ultimately, we do need a multi-pronged approach within the whole endoscopy ecosystem in terms of how we choose cases, how we manage the waste, but importantly, I think as a cornerstone, appropriate use of endoscopy is very crucial, and certainly IEE and AI is very important in this area. This is but just a smaller perspective, because if we look at it from a global perspective, we need to look at things like advocacy, we need to educate, do further research, we need to ensure that it is part of the way of life. And therefore, that's why I thought it's timely that I include this discussion about green endoscopy in my lecture today, so that we can sort of increase awareness of the need for this kind of attitude. So I've come to my last slide. I'd like to summarize by saying that advances in image-enhanced endoscopy and AI can improve the quality of GI endoscopy. This will enhance precision of endoscopic diagnosis and practice and reduce the need for unnecessary, repeat, or ineffective procedures. And by reducing inappropriate endoscopy, this is crucial for us for environmental sustainability. Thank you very much for your kind attention.